Hi class, so this is our last topic for the midterms portion of pharmacology, and our discussion is all about the anti-infectives. So in general, when we say anti-infectives, these are drugs which fight disease-producing microorganisms such as bacteria, viruses, fungi, and the like. So ano-ano yung mga gamot na yan? These are the antibacterials, the antifungals, the antituberculars, the antivirals, the antimalarials, and the antihelminthics. So let us discuss them one by one. But again, please review and take note that along the way we will be discussing the general concepts again, such as which of these drugs are safe during pregnancy, the pregnancy categories, the half-life, its routes, how do we give them, and other nursing responsibilities. So first are the antibacterials. So in your micropara, you've been discussing about bacteria. Bacteria are also called prokaryotes, and they are single-celled organisms lacking a true nucleus and a nuclear membrane. The bacteria, when they enter the human body, they reproduce, and they reproduce by cell division about every 20 minutes in general. And whenever these enter the human body, they produce toxins which cause cell death. That's why we get infected. Now, bacteria have a rigid cell wall, and the structure of the cell wall determines the shape of that bacteria. So there are several classifications of bacteria according to shape. Bacillus is rod-shaped. Cocci, they appear in spheres. Staphylo, they appear in clusters. And the Strepto, they appear in chains. Another is the classification according to staining. Staining in 1882 was discovered by, of course, you know him, I'm sure, Hans Christian Gram. He's a Danish bacteriologist, and siya yung nakadetermine the ability to retain a purple stain by a basic dye. Usually, the dye na ginagamit could be a crystal violet or methylene blue. So, if it turns purple, it's gram-positive. And if it is not stained, it is gram-negative. So, the following are the gram-positive and the gram-negative bacteria. And another classification is classification according to spectrum. Narrow spectrum, they are effective against one type of organism only. So either gram-positive, gram-negative. And the broad spectrum are effective on both gram-positive and gram-negative organisms. Now, as we go through the different antibacterials in the next slides, the mechanisms of these antibacterials or the action are whether they inhibit the bacterial cell wall synthesis, either they alter the membrane permeability of the bacteria, either they inhibit protein synthesis, or either they inhibit the synthesis of RNA or DNA, or sometimes antibacterials also interfere with metabolism within the cell. That way, they either inhibit the growth of the bacteria or they kill the bacteria. Now, let me first remind you about some terms which can be used interchangeably, but these terms have subtle differences in meaning. Antibacterials, sometimes you hear antimicrobials, and sometimes you also hear antibiotics. Okay? Yung tatlong term na yon. Again, it can be used interchangeably, pero meron silang mga maliliit na pagkakaiba. Antibacterials and antimicrobials are actually the same. These are the substances that either inhibit or kill a bacteria. Inhibit the growth or kill a bacteria. It's the actual substance. But when you say antibiotic, these are chemicals produced by microorganisms. And these again either inhibit growth or kill the bacteria. Now, antibacterials can also be bacteriostatic or bactericidal. As what I've said earlier, they either inhibit the growth or they kill. If antibacterials inhibit growth of the bacteria, they are bacteriostatic. And if antibacterials kill the bacteria, they are bactericidal. Okay? Also, as other concepts that you need to remember are the words sensitive and resistant. Okay? Body defenses, our body, and antibacterials that we take should work together in order to stop the infection. But a bacteria may either be sensitive or resistant to the antibacterials that we take or that people take. When you say sensitive, it means the pathogen is either inhibited or destroyed. But if an antibacterial is resistant, the pathogen continues to grow. All right. Also, other terms are antibiotic combinations, and those are additive effects, potentiative effects, and antagonistic effects. So when you combine antibiotics because of an additive effect, the sum or the effect is actually the sum of the two antibiotics combined. But when you say potentiative effect, okay, one potentiates the effect of another, which increases its effectiveness. And third, you combine antibiotics because of the antagonistic effect. For example, when we combine penicillin and tetracycline, later on we will further discuss those antibacterials. Penicillin is bactericidal and tetracycline is bacteriostatic. So when you use them together, desired effect may be reduced. So again, sensitive, resistant, and when we talk about antibiotic combinations, it's either additive, potentiative, or antagonistic. Alright, now let's try to go to the general adverse reactions when giving antibacterials. There are three general adverse reactions. It's allergic reaction, it's superinfection, and it is organ toxicity. So when we talk about allergic reactions, it's allergy. I'm sure you're all familiar with allergies. There are only two kinds of allergy, mild and severe. There's no moderate allergy. So pag meron kang mild allergy because of a drug, no? Pero hindi lang naman sa mga gamot nagkakaroon ng allergy. But because we are talking about drugs, so if you have mild allergy to drugs, minsan meron kang rashes, nangangati ka, no? There's itchiness, pruritus, you have hives, or pinapantal ka. Basically, mga integumentary system manifestations. So, ang management doon, you simply take antihistamines. But, if your allergy is severe, in 20 minutes, there could be anaphylactic shock. Alright? There is already ineffective tissue perfusion because of severe vasodilation. Kaya pwede kang magkaroon ng shortness of breath, vascular collapse, nagkaroon ka na ng laryngeal edema, nagbronchospasm ka na, or pinakadelikado, mag-cardiac arrest ka. Okay? It's a medical emergency, severe allergy. So, you need to take antihistamines also. But, aside from that, it's very important that you have an epinephrine and a bronchodilator also. It should be given as an emergency drug. epinephrine and bronchodilator. So I will not anymore go through that. You know the reason why epinephrine and bronchodilators are okay or are effective for severe allergy causing shortness of breath, vascular collapse, laryngeal edema, bronchospasm. Okay? The second general adverse reaction is superinfection. When we say superinfection, may infection ka na nga, nagkaroon pa ng superinfection. Superinfection is a secondary infection because the antibiotic have altered the normal bacterial flora. Meron tayong tinatawag na good bacteria sa ating katawan. Si antibiotic, even the good bacteria, napapatay niya. Okay, so yun yung normal bacterial flora na na-alter because of the antibiotic. Usually, ano ba yung mga secondary infections? So, meron sa GI tract, respiratory tract, urinary tract, genitourinary tract, even the skin. At mas common ito sa mga broad-spectrum antibiotics. At lalo na if you give the antibiotic less than a week. Kaya nga majority of antibiotics, you need to take it at least 7 days. Okay? The third general adverse reaction to antibacterials is organ toxicity. So as we go through the discussion, marami tayong maririnig na hepatotoxic, which means delikado sa atay yung gamot. Nephrotoxic, because means delikado sa kidney yung gamot. So again, going back to our discussion on the basic concepts of pharmacology. Diba? The liver, it's the major site of metabolism. The kidneys, it's the major site of drug elimination. So, yung mga aspetong yun, posibleng mag-cause na mas delikado sa mga organs na yon yung mga gamot. Others could be ototoxic, no? So delikado siya sa lalo na sa cranial nerve, auditory nerve. It could be neurotoxic, okay, and other organ toxicity or other organs may be affected. Okay, these now are the antibacterials. So madami siya. We first discuss the penicillins as the antibacterial. Si penicillin, it's a natural antibacterial obtained from a mold. It's Penicillin notatum. And it's actually the first antibacterial. No? 1928 pa lang si Alexander Fleming. He's a British bacteriologist and yung kanyang mga molds no, na kinoculture, nakita niya na contaminate siya. The bacterial cultures na inaaral ni Alexander Fleming ay na-contaminate ng molds. At dahil contaminated ng molds yung kanyang bacterial culture, na-inhibit nito yung bacterial growth. Now, it was in about 1930s or 1939. Si Howard Florey, siya yung nag-expand ng findings ni Fleming. And he purified the penicillin, no, obtained from the mold so that it could be used commercially. Kaya nagamit na siya noong World War II, lalong-lalo na doon sa mga sugat and respiratory infections ng mga sundalo. And in 1945, it has been labeled as a miracle drug kasi na-treat yung mga wound and respiratory infections during World War II. Now, the penicillin has a beta-lactam structure. And that beta-lactam structure interferes with the bacterial cell wall synthesis. And that's the reason why nai-inhibit yung bacterial enzyme para magkaroon ng bacterial division Therefore, nagkakaroon ng bacterial cell death. Okay? Uh, ang kaso, no, maraming bacteria ang nagpo-produce ng enzyme. And these enzymes are called beta-lactamase, sometimes called penicillinases. And these beta-lactamase actually inactivates the beta-lactam structure of antibiotics. Nagkaroon ng mutation. Now, nagkaroon ng mga panibagong grupo ng antibiotics kung saan kaya rin nilang labanan even if the bacteria was able to produce the beta-lactamase. Again, si penicillin, pwede siyang bacteriostatic and bactericidal depending on the drug dose. Now, there are 4 general classes of penicillins: the basic penicillins, the broad-spectrum penicillins, the penicillinase-resistant penicillins, and the extended-spectrum penicillins. Ang basic penicillins, siya si Pen-G at si Pen-V. It's the first penicillin. Okay? Pwede siyang ibigay ng oral and parenteral. So, sa parenteral, IM and IV. Now, si oral penicillin, it has a poor absorption. Okay? Kaya nga naaalala nyo noon, di ba, nung first discussion natin, si penicillin sodium and penicillin potassium. Kaya siya dinagdagan ng sodium and potassium for better absorption. Because oral penicillin is poorly absorbed in the GI tract. In fact, only 1/3 of it reaches the circulation. Kaya nagkaroon ng parenteral. So, meron ng IM, saka IV na penicillin. Now, yun namang procaine, no? Merong Pen-G procaine. Kasi ang penicillin injection, lalo na yung IM, masakit. And the procaine has been added to penicillin to decrease pain due to the injection. Si penicillin G benzathine naman is a long-acting penicillin. Okay, remember also, yung mga penicillin, if you add probenecid sa discussion natin ng anti-gout medications last time, plus probenecid, it increases penicillin in the blood. Okay, so you have to cautiously give these 2 drugs together. Now, many people are allergic to penicillin. If they are allergic to penicillin, they may actually take macrolides. And these are other types of antibacterials that we will discuss further. But the most common macrolide na pwedeng pamalit sa mga allergic sa penicillin is erythromycin. Si Pen-V, it's actually less potent than Pen-G. Mas effective siya sa mild to moderate infections. But si Pen-V has an increased ability to penetrate gram-negative bacteria compared kay Pen-G. Now, after a few years, mutant strains of Staphylococcus developed resistance to Pen-G and Pen-V. Hence, nagkaroon ng pangalawang grupo ng penicillin. At yun yung mga broad-spectrum penicillins. They are also known as aminopenicillins. Okay? Pwede sila pareho sa gram-positive tsaka gram-negative bacteria, but they are not broadly effective against all. Okay? Also, ang mga antibiotics na ito or mga penicillins na ito ay not penicillinase resistant. Okay? They are not beta-lactamase resistant, meaning these drugs are readily inactivated basta't nag-release yung bacteria ng beta-lactamase. So, nagiging ineffective siya against Staphylococcus. Alright? Kaya, nagkaroon ng pag-develop ngayon ng tinatawag nating beta-lactamase inhibitors. Okay, may 3 beta-lactamase inhibitors. One is clavulanic acid. Kaya nakita nyo dito si amoxicillin, may kadugtong siyang clavulanate. So, amoxicillin, clavulanate. Clavulanic acid is a beta-lactamase inhibitor, which means kapag mag-release si bacteria ng beta-lactamase, hindi na siya magiging resistant. Okay? Kakayanin niya na i-inhibit yung growth or kill the bacteria itself. The second beta-lactamase inhibitor is sulbactam. And again, you can see here, meron ding ampicillin sulbactam. So, the sulbactam is the beta-lactamase inhibitor. Again, para hindi maging resistant si penicillin against the beta-lactamase ng bacteria. Okay, and the third is tazobactam. Alright, again, the three beta-lactamase inhibitors are clavulanic acid, sulbactam, and tazobactam. Again, when antibiotics are combined with these beta-lactamase inhibitors, the resulting antibiotic can now inhibit the beta-lactamase. This makes the antibiotic effective and extends its antimicrobial effect. Okay? Remember that the beta-lactamase inhibitors are not given alone, but combined with penicillinase-sensitive penicillins, which are written as an example here. All right. I think you're familiar with the antibiotic Augmentin. That's the brand name. No? Augmentin is actually amoxicillin clavulanate. Okay? The third group of penicillins are the penicillinase-resistant penicillins. They are termed as anti-staphylococcal penicillins, which means they are good for staphylococcal infections. They are not effective against gram-negative bacteria, and they are less effective than Pen-G against gram-positive. Alright? So, these are the penicillinase resistance. That's why wala na silang beta-lactamase inhibitors na kadugtong sa pangalan nila, because they themselves were developed specifically for the beta-lactamase, lalo na ng staphylococcal infections. Alright? The fourth group of penicillins are the extended spectrum penicillins. They are anti-pseudomonal penicillins. So, ang pseudomonas or pseudomonal infection, from a gram-negative bacillus, and it's very difficult to eradicate. Pwede rin siya sa iba pang gram-negative. Ano pa yung mga yon? Klebsiella, Enterobacter, okay? Again, si extended spectrum ay hindi ulit penicillinase resistant. Kaya pwede ulit mag-add dito ng beta-lactamase inhibitor. So here you can see piperacillin tazobactam. No? Also may ticarcillin clavulanate. So may dinadagdag sa kanila na beta-lactamase inhibitors. Extended spectrum penicillins have the same pharmacologic action with aminoglycosides. So mamaya we will discuss aminoglycosides, amikacin, gentamicin, streptomycin, but they are less toxic. Aminoglycosides, again, if you remember, nung first discussion natin, isa siya sa mga gamot na merong low therapeutic index. Okay? Kapag may low therapeutic index, meron siyang narrow margin of safety, so the drug is actually may be toxic even if you give it at the correct dose, at the correct route, everything. So, less toxic effect itong grupo ng gamot kesa aminoglycosides, but the same pharmacologic action. Alright? As a summary sa client teaching, you have to finish the entire prescribed penicillin. Even if you are feeling well already, Pero ang gamot o ang antibiotic o ang penicillin ay kailangan tapusin ng 7 araw. You have to finish it in 7 days. Sometimes, antibiotics may need to be given until 14 days. Also, you have to increase fluid intake. If you have an infection, no, you might have fever also. It may aid in decreasing body temperature, and also increasing fluid intake will hasten excreting the drug. It's important that you monitor your body temperature, syempre, no, especially the infected area. Chewable tablets must be chewed or crushed before swallowing, so they are not enteric coated. Okay? Take with food to decrease GI irritation. So, lalo na pag merong GI upset. If taken orally, avoid acidic foods and fluid. Also, you have to watch out for allergic reactions, whether mild or severe. No, nabanggit na nga kanina na kapag may allergy sa penicillin, pwede ang macrolide. Most common is erythromycin. Do not mix it with aminoglycosides. No? And the high doses may also cause platelet aggregation. Kaya kapag high doses ang penicillin, watch out for bleeding tendencies. And lastly, if penicillins are being taken by women who use pills as a family planning method, penicillins decrease effectiveness of pills or oral contraceptives. So the mother might need an additional family planning method kung ganun man yung purpose niya for taking the pills. Okay, the second group of antibacterials are the cephalosporins. Si cephalosporins naman, it was discovered in seawater noong mga 1948. But it was in 1960s na nagamit yung clinical effectiveness niya. It's from a fungus, Cephalosporium acremonium. It was found to be active against gram-positive and gram-negative bacteria, and cephalosporins are actually resistant to beta-lactamase. Okay? Dahil doon, hindi kailangan ng beta-lactamase inhibitors. To be more effective against numerous organisms, the molecules are chemically altered now. Semi-synthetic cephalosporins are used. Okay? Since pareho sila na beta-lactam structure ng cephalosporin, no, it also inhibits bacterial cell wall synthesis. And also, dahil nga pareho sila ng penicillin, kung allergic ka sa penicillin, allergic din ikaw sa cephalosporins. So there are 4 generations of cephalosporins. Para siyang iPad, first gen, second gen, third gen, fourth gen. The first gen, effective against all gram-positive and most gram-negative, but destroyed by beta-lactamases. Okay? So, the names are there, cefazolin, cefalexin, yan yung mga common. Second gen, effective against all gram-positive. They possess broader spectrum for gram-negative, but not all are affected by beta-lactamases. Okay? Cefaclor, cefuroxime, those are the common second-gen cephalosporins. Third gen, effective siya all gram-positive and all gram-negative and resistant to beta-lactamases. Okay? And the fourth gen, gram-positive, gram-negative, all, they possess broader spectrum sa gram-positive and again, resistant to beta-lactamases. So, yun yung cefepime. Alright, cephalosporins are actually nephrotoxic. Importante na chine-check yung blood, urea, nitrogen, and creatinine to assess if the kidneys are still functioning well and effectively. Also, only a few of cephalosporins are given per orem. No? uh, excuse me, ang meron lang dyan, cefalexin, cefaclor, cefuroxime, mga per orem yon. The rest are all parenteral, either IM or IV. So again, report superinfection, such as mouth ulcers, or anal and genital discharges caused by a fungus. It's a Candida albicans infection. It's a fungal infection. Ingest buttermilk or yogurt to prevent superinfection. Kasi ang buttermilk or yogurt, maraming good bacteria. No? Sa atin, sikat yung Yakult. It's good bacteria, Lactobacillus shirotus strain. It can prevent also superinfection, especially with long-term cephalosporin use. Third, you have to complete the course of medication again, kung 7 days, 7 days, 14 days, 14 days. If you're feeling well already, you still need to finish the course of therapy. Fourth, all IV cephalosporins are painful. No? They can cause irritation. So, hindi dapat basta-basta ina-IV push. Kailangan siyang ini-infuse over 30 minutes. Alright? Remember sa ating medications and calculations, if you are to infuse it over 30 minutes, no? So, you will compute para mag-run siya for 30 minutes. Okay? So, there's formula. Fifth, for oral suspensions, refrigerate. And then number 6, watch out for these side effects. And the patient can report these adverse effects. The third group of drugs are the macrolides. Right? Now, the next 4 antibacterials that we will discuss. So, una si macrolide, yung susunod dito, lincosamide, and then vancomycin, and then ketolides. Yung 4 na sunod-sunod na yon, similar, no? Spectrum is similar to penicillin, which means they may act as substitutes for those with penicillin allergies. Pero nabanggit ko na nga kanina, macrolides ang pinaka-common at sa macrolide, erythromycin. Pero yung next 4 antibacterials from macrolide can also replace penicillin. Macrolides are broad-spectrum antibiotics. They bind to ribosomal subunits and inhibit protein synthesis. Low doses, bacteriostatic. High doses, bactericidal. So, paano siya binibigay? May per orem at may IV. Again, if you give IV, kailangan infusion. Okay? Para hindi magkaroon ng phlebitis or inflammation of the blood vessel. It is not given IM kasi very painful ang macrolides. And active siya, most gram-positive but some gram-negative. No? They are good for mild to moderate infections ng respiratory system, GI infection, skin infection, soft tissue infection, pwede rin ang macrolides for some STDs. So, these 3 are the macrolides: azithromycin, clarithromycin, and erythromycin. So, you have to monitor liver enzymes. Macrolides are hepatotoxic, especially if used on a long-term basis. When you take oral drugs, no, best given kapag empty stomach. Okay? But if GI upset occurs, better na full stomach. Also, pag nasa antacids, no, if a person or if a patient is taking antacids, meron siyang hindi magandang combination with macrolides, give the antacid, give 2 hours before, no, or 2 hours after the macrolide. The side effects are nausea, diarrhea, abdominal discomfort. Kaya nga pag meron ito, just take the drug with food. And, this is important, ang erythromycin, do not use it concurrently with the following drugs. Alright, verapamil, and diltiazem. Silang dalawa ay antihypertensive drugs. Si clarithromycin is another macrolide. Fluconazole, ketoconazole, and itraconazole, sila ay mga antifungal drugs. Why do you need to not combine erythromycin with them? Because risk of sudden cardiac death increases. Okay, the next group of drugs are the lincosamides. Dalawa siya, clindamycin, tsaka lincomycin. Okay, they inhibit bacterial protein synthesis and again, bactericidal and bacteriostatic. Active siya most gram-positive pero hindi siya pwede sa gram-negative organisms. Side effects again, dahil halos puro GI upset yan, GI irritation, nausea, vomiting, stomatitis, give it best on a full stomach. Also, lincosamides are incompatible with the following drugs. Nawawala yung effectiveness ng gamot pag kinocombine sa aminophylline. It's a bronchodilator. No? Phenytoin, it's an anti-seizure drug. Barbiturates, also pwedeng anti-seizure, anti-anxiety, pwede siya as a sedative hypnotic. And ampicillin, it's another penicillin. Now, between the two, clindamycin is more widely prescribed. Why? Kasi better absorbed siya sa GI tract. Na-maintain din yung higher serum concentration ng gamot, so mas more effective siya. Plus, ang clindamycin ay may fewer side effects compared kay lincomycin, lalo na it causes colitis. Okay? Another group or another drug is vancomycin. Vancomycin inhibits bacterial cell wall synthesis. Ang peak action niya ay 30 minutes right after you administer the drug. It's a glycopeptide used for drug-resistant Staphylococcus aureus organism. Okay, you can use vancomycin when all the rest fails. It can also be used for cardiac surgical prophylaxis, tsaka yung pwede rin siya for those with penicillin allergy. It's ototoxic, it's nephrotoxic, and it can also cause vascular collapse. Now, ang vancomycin may per orem tsaka may IV. Pero sa per orem, no, yung per orem na vancomycin, it is only for colitis. If you have inflammation of the colon, infection of the colon, since it is not absorbed systematically. Okay? Per orem is excreted in feces. Pero yung IV vancomycin is excreted in urine. And the IV vancomycin is for a systemic infection. Unlike the oral colitis, pang GI infection lang siya. Kasi hindi siya na-absorb eh. So yung gamot, nandun lang rin sa GI tract. Remember that when you give vancomycin as an injection, always give it via infusion. Pwedeng 1 hour. No? 2 rapid IV injection of vancomycin will cause the red man or the red neck syndrome. It's because of release of histamine pag masyadong mabilis ang pagbibigay ng IV vanco. Okay? Pag sinabing red man or red neck syndrome, magkakaroon yung patient ng red blotches on the face, on the neck, minsan pwede din sa chest. If you look at it, no, mukhang may red blotches, para siyang allergy. But if it is caused by too rapid injection of vanco, that is not an allergic reaction. It's a toxic effect. So it's very important that you give vanco not as a rapid IV injection but as an infusion. Also, ang vanco is not effective sa enterococcus. Okay? Kaya meron diyang quinopristine or dalfopristin. Okay? Linezolid is also okay. No? Pwede sila for Enterococcus and Staphylococcus, yung dalfopristin. And si linezolid naman, it's also a reserve antibiotic for gram-positive bacteria. Lalo na kapag hindi pa nag-respond sa vancomycin. Linezolid is also a weak MAWI. And going back to MAWIs, ano yung mga pagkain na dapat iwasan because of the risk of hypertensive crisis? Those are foods that are tyramine rich. Okay? Next are the ketolides. Siya yung telithromycin. It's a new classification of antibiotics structurally related to macrolides. It blocks protein synthesis of bacteria. Okay siya for Streptococcus, Pneumoniae, and Haemophilus influenza organisms. It's also well absorbed by GIT, kaya per orem lang siya. It's not also affected by food intake. Okay? So, the following are their side effects. Just watch out if a patient has myasthenia gravis, telithromycin may lead to exacerbation of MG. Na-discuss din natin briefly ang MG sa nervous system drug. It's a nervous system disorder characterized by extreme muscle weakness. Okay? Telithromycin is only given for adults, 18 years old and above. So, pwede siya for those with acute bronchitis, acute bacterial sinusitis. Pwede rin siya sa community-acquired pneumonia. I mentioned a while ago also that okay siya as a per orem drug. No? Per orem drug lang siya. It's excreted in feces and urine. And telithromycin also is not commonly used. Medyo mataas yung kanyang protein binding capacity. It's 60 to 70% protein bound. Ang half-life din niya medyo matagal, 10 hours. Pero mabilis ang kanyang action. Peak action is in 1 hour. Okay? Next are the tetracyclines. The tetracyclines is the first broad-spectrum antibiotic effective against gram-positive and gram-negative bacteria, including these mentioned microorganisms. But they are not effective sa Staphylococcus, sa Pseudomonas, or Proteus organisms. Okay, so okay siya sa Mycobacteria, Rickettsia, Spirochete, and Chlamydia. Ano ang kanyang mechanism of action? They inhibit bacterial protein synthesis, and tetracyclines are bacteriostatic. Now, ang tetracycline, pwede siya for H. pylori infection. Okay? Si H. pylori infection is because of an infection by Helicobacter pylori. It's a bacterium in the stomach na nagkakos ng peptic ulcer. At effective ang tetracycline sa H. pylori, lalo na with combination ng metronidazole and bismuth subsalicylate. Si metronidazole, we'll discuss that further later. Bismuth subsalicylate is a salicylate. Okay, just like aspirin. Okay? Pwede rin ang tetracycline sa severe acne vulgaris, mga pimple, and other systemic infections. So, per orem, merong IM, merong IV, pero among all these, mas common na pine-prescribe ang oral na tetracycline. Okay? Si acne vulgaris, may I just go back to it? Oral and topical tetracycline are effective para sa severe acne vulgaris. Doon naman sa mga STD, no, yung systemic infections, STD is one. Pwede ang tetracyclines doon. and also UTI. Okay, but let me just add some additional antibacterials for UTI na not under tetracycline, but aside from tetracycline are good for UTI. Ito yung nitrofurantoin, it's one. It treats acute UTI. It can also act as a prophylaxis against UTI, nitrofurantoin. Second is methenamine. Methenamine naman is for chronic UTI. And third is chloramphenicol. Chloramphenicol is for severe UTI. Okay? Just an additional for UTI infections. Now, it's important that when you take tetracycline, now going back, you have to avoid antacids, avoid iron-containing drugs, avoid drugs high in calcium, and even milk. Why? These can inhibit absorption. But there are new lipid-soluble drugs which are better absorbed with milk and food. No? Adverse effects, so GI, disturbances, photosensitivity. If a patient experiences photosensitivity as a side effect of the drug, what you need to teach to them is whenever they go out of the house at may araw, wear eyeglasses or sunglasses or a shade, magpayong, no? Sa skin, maglalagay din ng lotion, no? Or mga sunblocks. It's also nephrotoxic and it can also cause superinfection. So, pag pwede siyang mag-cause ng superinfection, so magte-take tayo ng mga pagkain. Let's teach them to eat yogurt, no? Buttermilk, Yakult, and the like. Okay? When taken with oral contraceptives again, no, pills, effect of pills will be lessened. So again, sa babae, if a woman is taking pills to prevent pregnancy and she's taking tetracycline, she might need an additional or another method of contraception. Tetracyclines also should not be given to pregnant women and children below 8 years old. For pregnant women, there are two reasons. During first trimester of pregnancy, it's teratogenic. Tetracycline can cause placenta, and during the first trimester of pregnancy, it can harm the fetus. And sa third trimester ng pregnancy naman, kasama ng mga bata below 8 years old, if they take tetracycline, it can cause permanent teeth discolor. Okay? It irreversibly colors the permanent teeth. So, prevent women in the third trimester and the children below 8 years old. These are the tetracyclines, no, short-acting, intermediate-acting, and long-acting. Okay? Next is glycylcycline or the tigecycline. It's a synthetic analog of tetracycline and also blocks protein synthesis, so bacteriostatic ang action niya. It's a new category of synthetic tetracycline. So, saan ito pwedeng gamitin? Skin infections, GI infections. Caused by Staphylococcus, E. coli, Streptococcus, Klebsiella, and Clostridium perfringens. Also, ang tigecycline, no, with pills. So, if given with oral contraceptives, pills effect is lessened. And also, warfarin levels may be increased at kapag nangyari yun, nagkakaroon ng increased risk for bleeding. Pag ganon, if the drug can increase the risk for bleeding, we should always teach patients to brush their teeth using soft bristled toothbrush. Pangalawa, sa mga lalaki, yung mga nag-shave, no? It's better that they use an electric razor. Kasi yan yung mga madaling ginagawa mo araw-araw na pwede kang magkaroon ng sugat or magdugo. Nagtitake ka ng gamot na nag-i-increase ng risk for bleeding. So you have to prevent those further increase in the risk. Okay? Ang tigacycline ay binibigay ng IV. Again, you do not give it as an IV push. You have to give it as an infusion for 30 minutes to 1 hour. Ang tigacycline din ay pregnancy category D. Okay, and you all know dapat what pregnancy category D is. Next are the aminoglycosides. They inhibit bacterial protein synthesis and they are indicated for serious infections of gram-negative bacteria, but only for some gram-positive. Alright? Mostly, aminoglycosides cannot be absorbed through the GI tract. And also, they cannot cross the cerebrospinal fluid, except sa bata. In children, aminoglycosides can cross the blood-brain barrier. Aminoglycosides are also ototoxic, nephrotoxic, and if you administer them with penicillins, aminoglycoside effects are greatly decreased. Si aminoglycoside, pag tinitake, kailangan minomonitor ang peak and throw level. We have discussed before peak and throw level. So, if peak level is above 12 grams per ml and throw level is above 2 grams per ml, it indicates toxicity. Aminoglycosides has a low therapeutic index. So, ang amikacin, no, it can be for amikacin and gentamicin both, no, for serious infection, sepsis, respiratory infection, systemic infection. Si neomycin, pwede rin niyang gamitin to cleanse the bowel before abdominal surgery. Okay? Si streptomycin naman, yan ang kaisa-isang TB drug na parenteral. Because the rest of the drugs for tuberculosis are oral. Si tobramycin, pwede yan for eye infections and other infections also. Okay? Now, those resistant sa aminoglycosides can be given penicillins and cephalosporins. Okay? Next are the fluoroquinolones. They interfere with DNA and they act on gram-positive and gram-negative bacteria. Bactericidal ang kanyang action. Fluoroquinolones can cause dysrhythmia. So, dapat chine-check ang heart rate, chine-check yung rhythm ng heart, pwedeng siyang magkaroon ng baseline ECG before and after also the drug. Fluoroquinolones also cause dizziness. So again, let us teach patients to avoid doing activities that require mental alertness. And fluoroquinolones are photosensitive. Paglalabas, mag-shades, magpayong. Okay? Ciprofloxacin, gatifloxacin, levofloxacin, moxifloxacin, and ofloxacin. Sila yung mga fluoroquinolones. Kanino yan pwedeng ibigay? Sa mga patient na may UTI also, may bone infection, may lower respiratory infections such as pneumonia, bronchitis, may mga GI infection, even STD, gonorrhea. Pwedeng bigyan ng fluoroquinolones. Alright, next are the lipopeptides. So, siya yung daptomycin. Ano ang mechanism of action niya? It acts by binding to the bacterial membrane and causes depolarization of the bacterial membrane itself. Therefore, nai-inhibit yung protein synthesis, DNA synthesis, and RNA synthesis. Effective ang daptomycin sa gram-positive bacteria. But look at the side effects. because of the severity of some of its side effects, hindi siya masyadong ginagamit. If given with tobramycin, daptomycin toxicity also increases. If you are to give daptomycin, again, IV siya. No? IV drug lang siya. Hindi siya binibigay as an IV push. Kailangan siyang i-dilute. When you dilute daptomycin, pwede lang siyang i-dilute sa NSS or D5LR. No other dextrose. Sulfonamides. Ang sulfonamides ay bacteriostatic because ano ang kanyang mechanism of action? They inhibit bacterial synthesis of folic acid. And it is folic acid is actually vitamin B9. It is essential for bacterial growth, especially effective ang sulfonamides sa E. coli and chlamydia. Sulfonamides are actually one of the oldest antibacterials. Early 900s pa lang, ginagamit na ang sulfonamides. They are also not classified as antibiotics. Na-explain ko kanina, pag antibiotic, galing siya dun sa microorganism, no? Chemicals, no? From microorganisms. Because they were not obtained from biologic substances, no? Galing siya sa coal tar derivative compound. At dahil hindi siya galing sa biologic substances, hindi classified as antibiotic ang sulfonamides. Okay? Now, na-mention natin, mechanism of action ng sulfonamides, they inhibit synthesis of folic acid. Okay? Vitamin B9 is acquired through our diet. It is required for biosynthesis of RNA, DNA, and protein. So, hindi siya pwedeng ibigay lalong-lalo na sa mga buntis because a pregnant woman needs folic acid, needs vitamin B9. Kasama yan sa mga pregnancy vitamins niya. Important for the brain and spinal cord development of the baby. Okay? If one is allergic to sulfonamides, malamang allergic, pwede siyang, okay if allergic also, with penicillin. So, pag allergic sa penicillin, sulfonamides can also be given. Many of the sulfonamides are oral. It's well absorbed in the GI tract. So, pwede siya for UTI, ear infections, and eye prophylaxis also. But sulfonamides can cause crystalluria or crystals in the urine. Because of that, fluid intake should be increased, at least about 10 glasses of fluid per day. At nabanggit ko nga kanina, do not give it to pregnant women, especially those in the 3rd trimester. So, si short-acting, yung sulfadiazine, and the rest, intermediate-acting. Si trimethoprim sulfamethoxazole, siya ay known as the acronym TMP-SMZ. No? If you're familiar again with cotrimoxazole. Si cotrimoxazole, yan yung trimethoprim sulfamethoxazole. Okay, next are the peptides. They are derived from the Bacillus subtilis, and its mechanism of action is interfering with bacterial cell membrane. Si polymyxin B sulfate, bactericidal, most gram-negative, ang high doses, nephrotoxic and neurotoxic. Okay? Yung oral tsaka IM route, not recommended, while IV route should be given as a slow infusion and not as an IV push. Bacitracine, on the other hand, is bacteriostatic and bactericidal. More on gram-positive and SAM gram-negative. It's not absorbed by GI tract. So, meron topical and ophthalmic na ginagamit. Okay, side effects include redness, rashes, nausea, and vomiting. Okay, si bacitracin, magaling siya sa mga skin infections also. The topical route. Okay, and it can be brought over the counter. Next is metronidazole. Metronidazole impairs DNA function of the bacteria, and it is used primarily to treat GI infections. Metronidazole can be given per orem, pwede rin siyang IV. Ang pinakamadalas na indication ng metronidazole ay amoebiasis. But this is very important to teach patients taking metronidazole. Alcohol should be avoided 48 hours after treatment is completed. Why? Because taking alcohol within 2 days of metronidazole can produce a so-called disulfiram reaction. Ang disulfiram reaction, delikado because it can cause cardiovascular symptoms, tachycardia, palpitations, hypotensions, to name a few. Pero systemic yung effect niya. May facial flushing din, may dyspnea, masakit ang ulo, pagpapawisan yung patient, may slurred speech siya, sumasakit yung tiyan, parang nasusuka. So, systemic, maraming organs involved. But because of the involvement, especially of the cardio and the respi, alcohol should really be avoided. The disulfiram reaction should be prevented. Okay, those are the antibacterials. Let's now move on to the second group of anti-infectives, and these are the antifungals. An infection caused by a fungus, ang tawag natin dyan, mycosis. And yung gamot, antifungal drugs or antimycotic drugs. Kamukha ng antibacterials na bacteriostatic or bactericidal, ang antifungals ay fungistatic or fungicidal. So, kapareho ng definition nila, pag fungistatic, the drug can inhibit the growth of the fungi. Pero pag fungicidal, the drug can kill the fungi. And this actually depends on the drug dose, of course, and susceptibility ng fungus. Usually, fungistatic at low doses, tas fungicidal at high doses. Okay, the photos you see are some of the superficial antifungal infections sa fingers, sa kuko, sa balat, sa buhok. Okay? Now, may systemic din, but actually pag superficial, no, usually the skin, the mucous membrane, the hair, the nails. Pag systemic, it could affect the respiratory system, the nervous system, the GI system. Alright? Also, anti or fungal infections are either mild or severe. Pag mild, one example is Tinea pedis, athlete's foot. Or severe, if it already involves the lungs or even the brain, such as pulmonary infections or meningitis. So, superficial infections are mild, systemic infections are severe. Also, fungal infections either are opportunistic or non-opportunistic. Pag opportunistic fungal infection, they occur in the immunocompromised. So, mga patients na may cancer, mga patients na may ibang sakit, no, malalang sakit, o may mga tinitake na gamot na nagpapadecrease ng kanilang immune system. Non-opportunistic fungal infections, on the other hand, they can occur in any individual. Okay? These now are the antifungal drugs. There are 5 general groups of antifungal drugs. The polyenes bind to fungal cell membrane, which forms open channels and increase cellular permeability. It leaks intracellular components, especially the potassium. So si amphotericin B, siya ay binibigay as an IV drug. And remember that Ampho B, the drug itself, is photosensitive. Ampho B does not cause photosensitivity, but Ampho B is photosensitive. Kaya, ibig sabihin, hindi yung patient na nagtitake nito yung lalagyan mo ng shades, babalutan mo, something like that. But the drug itself is photosensitive. So, when you give the drug, nilalagyan siya ng mga special covers para hindi ma-expose sa light yung gamot at mawawala yung effect niya. Okay? Minsan makakakita kayo sa ospital ng mga gamot na binabalutan ng color black. Pwedeng yung mga carbon paper na black kapag walang gamit, or pwede naman yung special cover for those drugs na photosensitive. If you give the drug as an IV, even the IV tubing should be covered. And then if the drug comes in a vial and it has been opened, the vial should also be covered. Ampho B also, plus adding a corticosteroid, increases renal toxicity, or it's more nephrotoxic, at nagkakos din siya ng hypokalemia. Nystatin is another drug, so oral naman siya. Pwede siyang oral. In fact, maraming mga mouthwash, minsan may nystatin. But of course, you do not swallow the mouthwash. You only swish it. That's why you need to swish it or imumog. Imumumog siya ng maayos. No? Para yung mga nystatin, kung meron man yung mouthwash, malilinis ng maigi or magiging effective yung gamot na nandoon. Okay? Azoles inhibit cytochrome in fungal cells. They interfere with formation of ergosterol, and this increases cell permeability again and leakage. Azoles are either given per orem o kaya IV. So, best yan kapag empty stomach. No? Pwede rin yan for, again, yung candidiasis, vaginal candidiasis. Pwede rin. Fluconazole, ketoconazole, turconazole, and the rest. Antimetabolites, they are selectively penetrating fungal cell and converts it into fluorouracil. It's an antimetabolite that disrupts fungal DNA and RNA synthesis. So, yun si flucytosine. Ang flucytosine, per orem siya. If you use it with Ampho B, it can increase therapeutic action. Okay? The echinocandins inhibit biosynthesis of essential components of the fungal cell wall. They interfere with fungal growth and reproduction. Ang mga echinocandins, mostly IV drug. Hindi siya na-absorb ng GI tract. Nag-iisa lang dyan ang per orem. Yun yung nicafungin. But the other two are IV drugs. And lastly are the antiprotozoals. They disrupt mitochondrial electron transport and they inhibit DNA synthesis. Antiprotozoals are all per orem. Pwede siya for mild to moderate pneumocystis carinii pneumonia. Okay? Next are the anti-TB drugs or the anti-tuberculars. We will not go through the specifics of tuberculosis. Okay? Because meron kayong separate discussion yan sa medical surgical nursing ninyo. But just to give you a brief review of TB, it's a highly contagious pulmonary disease na ang cause ay Mycobacterium tubercle bacilli. Mode of instruction or mode of transmission is through droplet, direct transmission, no, pag umuubo. Okay? And ang incubation period niya is average of 2 to 10 weeks. When we say incubation period, it's the moment the pathogen entered your body, nag-grow at nag-multiply, tapos nilabasan ka na ng signs and symptoms. Okay? Now, again, marami kayong discussions about TB sa inyong higher courses, but for now, these TB drugs, no, are actually given in combination. Ang nakikita nyo dito are the first line and the second line drugs. And what you will also see or read in our reference book is how other countries manage TB. But in the Philippines, so si Department of Health, we actually use the TB DOTS, the Direct Observance Treatment Scheme. At 5 gamot ang ginagamit natin for that. Okay? Ano yung 5 yon? Ethambutol, isoniazid, pyrazinamide, rifampicin, and streptomycin. Those 5 drugs. Why do you give these drugs in combination? Because they act on different phases of the bacterial cell life cycle. So, mas mabilis na napapatay yung bacteria. Okay? Now, before, TB is not treatable. But now, it is treatable because of these drugs, the anti-TB drugs. Mahaba nga lang yung gamutan. Average of 6 months to 9 months. Minsan, may mas humahaba pa doon. But if you just take the TB drug religiously, gagaling ka sa TB. Ang importante din doon because TB is droplet, no? Most probably, yung mga kasama mo sa bahay, baka nahawa na rin sila. So, kailangan natitreat din sila. Okay? INH is isoniazid, no? So, INH, rifampicin, and streptomycin, those 3 drugs are hepatotoxic. Okay? Ang INH naman, no? Additional sa INH. Ang isoniazid, given with pyridoxine or vitamin B6. It is best to be given with a vitamin B6 to prevent peripheral neuropathy. Kasi minsan, yung mga patient, pag natitake ng INH, nakakaramdam ng tingling sensations sa kamay at paa. Namamanhid, pwede silang parang yung may mga nararamdaman na karayom na maliliit, no? Na tumutusok dun sa mga kamay at paa. Okay, namamanhid or may tingling sensations, peripheral neuropathies. Rifampicin also can cause a change in the color of the urine. Red-orange color in the urine. Also, streptomycin is ototoxic. So, again, dun sa 5 gamot na yon, 4 doon oral, 1 lang doon yung injection, which is streptomycin. It's IM. Alright? It's best to take these drugs 1 hour before or 2 hours after your meals. Do not take antacids while on anti-TB drugs since this may disrupt absorption. Ang mga gamot na ito ay photosensitive, also causes photosensitivity. So, teach patients to wear shades, cover the skin, tayo. Alright, now, how do we know if these drugs are actually effective? The way to evaluate effectiveness of drug therapy is for sputum testing to be done. Doon mo makikita na wala ng buhay na tubercle bacilli. It's the sputum testing. It's also actually the diagnostic test that will tell you you have TB. So, again, to check effectiveness of the treatment, you again check the sputum. Alright, next are the antivirals. Antivirals are drugs, but they do not kill viruses. Compared to antibacterials, they kill bacteria. Antifungals, they kill fungi. No? Anti-TB drugs, they kill TB, tubercle bacilli. But antivirals cannot kill viruses. Viruses are self-limiting. Ang kaya talagang lumaban sa kanila ay ang ating immune system, ang ating immune cells. Okay? But what do antivirals do? They prevent or delay the spread of viral infection. Kaya nga pinakamahirap patayin ang mga viruses. Okay, very timely now, no? Very relevant now is the COVID, the virus. They inhibit viral replication by inhibiting or interfering with viral nucleic acid synthesis in the cell. So, ulitin ko, viruses are more difficult to eradicate than most types of bacteria. That's why vaccines are developed to prevent such diseases. Okay? Kaya nga kung natatandaan nyo ulit dun sa ating previous topic ng mga vaccines, they are generally viruses. Right? For influenza virus, herpes virus, and cytomegalovirus, may mga non-classified antivirals, amantadine, rimantadine, may purine nucleosides, acyclovir, ribavirin. So, may oral niyan, no? May ointment din. Okay, sa mga ointment, no, you have to, of course, when you, in all types of ointment, ng mga drugs, cover your lesion, you keep it off your eyes. If you are putting it or instilling it in your patient, wear gloves. Ideally, you give 0.5 inch of ointment to every 2-inch squared na skin. Alright? For herpes, it's actually a viral infection din, no? STD. So, habang nagagamot ka, hindi ibig sabihin nun, no, na acyclovir, hindi ibig sabihin nun na ikaw ay meron ng or magaling ka na at pwede na ulit makipag-sexual intercourse. Still, no sex while on this drug. It is also not for repeated infections as a herpes STD. Acyclovir specifically does not prevent recurrence. No, in IV, you have to give it in 1 hour also. Okay, neuraminidase inhibitor o oseltamivir or Tamiflu, tsaka zanamivir. Ang mga gamot na to magaling sa influenza virus, sa mga ubo, sipon. Actually, sa sipon, no, it's very good to take these drugs, oseltamivir or Tamiflu, within 48 hours after symptoms started. Minsan, humahatching-hatching ka pa lang o may nararamdaman ka na sasama ang pakiramdaman mo at aabot sa flu. Okay? Taking it within 48 hours will really hasten the speed of recovery. Ilang araw lang, wala na. In short, hindi tutuloy yung sakit mo. Okay? Topical, again, no? As what I've said, sa mga ointment, pag naglalagay, it's very important that when you put it in your patient, you have to make sure that you are safe. Prevent na mahawa ka. Gamma globulin, IMIV, blocks penetration of a virus into a cell. So, gamma globulin is rich in antibodies, and it's a form of passive immunity. It can prevent viral invasion, especially sa mga early infectious stage ng illness. Okay? These are the common side effects. Important to get blood and kidney tests done. So, CBC, also nephrotoxic siya. So, BUN, CREA. And again, no, sabi ko nga, very effective siya. Start the therapy within 2 days or within 48 hours after symptoms started. And I am talking here about the influenza. Okay? Lalo na yung oseltamivir or Tamiflu. Next are antimalarials. Antimalarials are drugs for malaria. And malaria is a disease caused by protozoan parasites, Plasmodium species. Okay? And this is carried by infected Anopheles mosquito. Incubation period, 10 to 35 days. Sa Pilipinas, meron tayong mga malaria-infested areas. One of which, in Palawan, meron. Okay? So, may dalawang phase. Tissue phase, invasion of body tissues, but does not produce any symptoms at all in human. Kaya delikado yung anti-malaria. Nasa early stage ka, wala kang nararamdaman. Pero pag nandun ka na sa erythrocytic phase na napakadelikado, from the word erythrocytic, it's erythrocytes, RBC invasion. Okay? It can cause chills, fever, sweating, followed by flu-like symptoms. Okay? Now, because the Philippines has areas na malaria-infested, may mga programa sa Pilipinas to actually eradicate malaria. One is through prophylaxis or prevention, especially sa mga lugar na may malaria, yung mga may Anopheles mosquito, or kung pupunta ka din sa mga lugar na yon. Second is treatment of acute attack. And third is to prevent relapse. So these are the drugs for malaria: chloroquine, hydrochloroquine, mefloquine, and the rest, quinine and the rest. Okay? So, ang mga gamot na ito, ano yung mechanism of action niya? Chloroquine is the most commonly prescribed. Okay? It actually eradicates malaria because it increases the pH in the malaria parasite. And this inhibits parasitic growth. Okay? Now, it's just contraindicated nga lang for those with retinal and ear damage. So, retina, it can cause retinal damage. So, better to check eye vision. Ear damage, no? Ototoxic siya. Cranial nerve number 8. Okay? Lahat yan ay per orem. Except chloroquine. Meron siyang per orem, meron siyang IM injection. The last group of drugs are the anti-helminthics. What are helminths? They are large organisms. Hindi siya microscopic. Kitang-kita mo siya with the naked eye. These are the parasitic worms, and they feed on host tissue. Body sites affected: intestine, lymphatic, blood vessel, and even liver. But, alam natin, ang mga bulate, most common site is intestines. Usual route or mode of transmission, oral fecal route. So, paano yung oral fecal route? Na isusubo mo yung kanilang mga itlog. Yung itlog nila, yun yung microscopic. At saan siya nanggaling? Sa feces. Meaning, if you do not wash your hands well, no? May poor hygiene, you can be infected with these helminths. There are general groups of helminths: the cestodes or the tapeworm. The first photo shows it. So makikita nyo yung uod segmented, no? Yung itsura niya, they entered intestines via food, oral fecal route. So may mga pork tapeworm, beef tapeworm, fish tapeworm, meron ding mga dwarf tapeworm, maliliit lang. Second are the trematodes or the flukes. So in the second photo, you can see the flukes are flat and they are non-segmented. They may also infect the intestines, the liver, the lungs, and even the blood. The third helminths are the intestinal nematodes. So sila yung mga roundworm, pinworm, hookworm, threadworm, whipworm. So in the third photo, you can see no, na talaga namang malalaki yung mga uod. Okay? In micropara, pinag-aralan nyo, Ascaris lumbricoides. So, isa siyang giant roundworm. Ganon din yung Enterobius. Pinag-aralan nyo yan. Siya naman yung pinworm. Okay? Pag ang bata ay infected niyan ng roundworm, masakit ang tiyan, abdominal pain. Yung pinworm naman, they cause itching in the anal area. Okay, mostly may nakikita tayong mga bata, malalaki yung tiyan. Pero mga payat. Usually sila ay infected ng mga bulate sa GI tract. And the fourth, in the photo, are the tissue-invading nematodes. They are the pork roundworms and the filariae. Yung mga pork roundworm, ito naman yung mga mahilig kumain ng mga raw or inadequately cooked pork. So, mga hindi masyadong luto o yung mga raw foods. Si filariae, in the photo you can see, no, nagkakaroon ng parang elephantiasis, naglalakihan ang mga lower extremities as the effect of the infection. These are the drugs, okay? These drugs no, are specific for different kinds of worms, which have been described in the previous slide. All are per orem, okay? And they are specific for intestines, no, mga intestinal drugs, no. They are poorly absorbed in the GI tract. Pero bakit siya per orem kung poorly absorbed in the GI tract? Which means hindi siya na-absorb sa system, nandun lang siya sa intestine. And in the intestine, nandun din yung helminths na i-destroy niya. That's why the drug is really effective. But again, most important kapag may mga patient na may ganito is hygiene, hand washing, and treating all the family members, because most probably, if one is infected, another is infected too. Okay? That's the end of the topic for the midterms part, no? For topic 5 on anti-infectives. So study well for your upcoming midterm examination.